Hi everyone, my name is Zuhur Jeshi, and today I'm going to be presenting my systematic review paper on mindfulness and weight loss among adults with obesity. In this presentation, I will go over some background information as well as the methodology that I used to conduct my research, moving forward to the results, discussion, and the conclusion. Obesity is recognized as a chronic, non-communicable disease characterized by excess weight and the accumulation of body fat. Even though a lot of health and medical professionals and researchers in the field do recognize obesity, it still remains as a problem and has in fact become a worldwide epidemic. 34% of adults and 15 to 20% of children and adolescents in the United States are obese, and these percentages are quite alarming and call for the need of an immediate intervention. Obesity has related comorbidities that may include high blood pressure, high blood serum levels like elevated low density lipoprotein or triglycerides, type 2 diabetes, coronary heart disease, stroke, gallbladder disease, osteoarthritis, sleep apnea, and clinical depression, among others. Different approaches over the years have been used to help individuals lose weight, with countless weight loss strategies and interventions in existence. Different interventions include calorie restricted diets and behavioral therapies. Calorie restricted diets have been shown to be effective for weight loss, yet limiting caloric intake to a certain extent can yield negative health outcomes among individuals. Behavioral therapy is also another form of intervention that has been used to combat obesity. It is basically a psychological treatment that has also been shown to be effective for problems like depression, anxiety, alcohol and drug abuse, marital problems, eating disorders, and other mental illnesses. Lifestyle and dietary programs to combat obesity tend to be less robust long term, whereby individuals tend to lose an average of around 7 to 10% of their initial body weight at first, but then they regain around one third of it after a year of treatment, and they then approximately half of the participants regain their original weight within 5 years, and thus this puts um, those kinds of interventions into question since their long term effects are questionable. Studies over the years have theorized that obesity related eating behaviors are in part explained by the inability to recognize hunger and satiety cues, which in turn lead to, or basically are, a lack of awareness, which in turn is linked to overeating and compulsive eating, followed by higher risk of gaining weight. This obesity related theory to eating behaviors led researchers to look into mindfulness based interventions, and therefore, this is why we see that this specific type of intervention has gained a lot of recognition in literature. So, the question to be asked is, what is mindfulness? Mindfulness is basically a practice derived from Zen Buddhism, and has become popular as a self calming method, which has been incorporated into interventions that are also designed to change eating behaviors. Mindful eating is part of mindfulness and it is being widely used in combination with behavior change programs that are targeting weight loss. The practice of mindfulness has been shown to help people develop skills to manage chronic pain, diseases, depression, sleeping disabilities, and anxiety. And as mentioned, mindful eating, which is a part of the mindfulness, uh, is or involves paying attention to food moment by moment without judgment and to let go of any negative feelings related to food. There are different attitudes associated with mindfulness, such as acceptance, patience, and self awareness. A randomized controlled trial among 128 adults with obesity incorporated an acceptance based weight loss intervention versus a standard behavioral program, and this showed significant weight loss in the intervention group, both after the intervention immediately and at follow up. Another study among 14 adults who received a curriculum on mindfulness with a focus on emotions, mindful eating, emotional triggers of hunger, stressors, and also participated in mindful activities, showed that they were able to change psychological factors that caused them to overeat and thus hindered their weight loss effort. So, the methodology that was used for this systematic review was based on the PRISMA framework. Um, Five databases were used: PubMed, ScienceDirect, Scopus, Google Scholar, and the University of New England Library. Boolean combinations of different variations of the terms related to the question and that was being studied were used, such as mindful eating in adults and weight loss, mindful eating and adults with obesity, mindful eating, mindfulness in adults and weight loss, and as such. As you can see over here, the records that were identified through the databases were 252 studies. After the duplicates were removed, there were 247 studies remaining, of which 227 were excluded. A remainder of 26 studies were screened, and 6 of them were excluded because they were not looking at the age group in question or they were measuring outcomes that did not look at weight. After those 6 studies were excluded, the remaining 20 were assessed for eligibility and they were accepted and included in the quantitative and qualitative. The results were grouped into themes: acceptance based mindfulness intervention and weight loss, 4 randomized controlled trials, and 3 pilot studies from the 20 articles that were accepted examined the effectiveness of an acceptance based mindfulness intervention and on weight loss and found significant results among those studies for weight loss, thus indicating that an acceptance based mindfulness intervention had a positive impact on weight loss. From those mentioned studies, I will discuss 2 in details. The first one was a randomized controlled trial among 128 adults between the ages of 25 to 65 with a BMI of 27 to 40. The participants were randomized to 2 groups: a control which received standard behavioral treatment, and an acceptance based mindfulness group, which received a behavioral intervention with mindful eating, with sessions that consisted between 30 to 75 minutes of mindfulness based practices. The post intervention results showed that the individuals in the intervention group significantly lost or had a significantly higher weight loss percentage than their counterparts in the control group, thus showing that a mindfulness based intervention is indeed effective um, in decreasing weight among adults with obesity. On the other hand, however, one randomized controlled trial with 79 adults with obesity randomized these individuals into three groups: an acceptance based group, an awareness based, and a standard behavioral control group. The results did not find that an acceptance based mindfulness intervention to be more effective compared to the awareness group or the control group. Yet, weight loss was seen in all three groups after the intervention. Another theme was mindfulness based interventions with mindful eating as a component. Four clinical studies exploring mindfulness based interventions with mindful eating showed weight loss trends, even though the results were not statistically significant. One randomized controlled trial, which I will discuss, randomized 62 adults with obesity into an intervention group that received four workshop sessions with mindful eating as a component. The results showed that BMI decreased for the intervention group by 0.31 kilograms per meter squared, while it increased by a value of 0.11 for the control, thus showing that a trend in weight loss was seen for participants who completed the intervention group with a mindful eating component. Another theme was the relationship between intervention duration and weight loss. Five randomized controlled trials had significant findings related to weight loss, and all of them had longer intervention times compared to other studies. And longer intervention times were usually, or among those the studies that were mentioned and that showed significant results were more than 6 months. Another theme was small sample size effect on mindfulness and weight loss. Mixed methods pilot study with only 12 participants showed non-significant results for weight loss, which could be explained by the small sample size. One last theme that was developed was intervention and weight maintenance. Three randomized controlled trials showed that the mindfulness based intervention was effective even after the completion of the treatment. This suggests that skills that are learned and acquired during studies that focused on mindfulness were effective not only immediately but also afterwards, whereby participants were able to successfully practice them and thus successfully continue losing weight and maintaining healthier habits. The discussion of the results is as follows. Basically, an acceptance based mindfulness intervention focusing on helping individuals accept and commit to strategies that help them facilitate their dietary adherence by recognizing internal states like satiety cues and hunger cues, helps individuals by aiding them in eating less unhealthy foods, which in turn affects their dietary habits, allowing them to make healthier choices that can also positively impact their weight status. A mindfulness training involving guided eating meditations and mindful eating practices also allows individuals to eat smaller amounts of enjoyable foods like sweets, since they become more aware of the emotions related to that food and their cues for hunger and satiety, as well as the health benefits related to the items that they are eating. As shown as well from the findings of the studies, long interventions help teach participants about mindfulness extensively in a way that they can adopt these skills and practice them on the long run, on the long term, in order to positively impact their health and weight status. Only one study compared a mindful eating mindfulness intervention to mindful decision making based mindfulness interventions, um, and the results showed that mindful eating was not more effective than awareness based mindfulness. However, both kinds of mindfulness were effective um, in yielding positive results. However, a possible explanation for this could be time. The time allocated for the intervention did not exceed 6 weeks, and therefore participants could have needed more time to be able to practice mindfulness more successfully and to learn the skill, since the skill of mindfulness needs time and practice. As any review, there are several limitations to both these studies and the paper. Um, a very important limitation in this paper is that it was reviewed by only one researcher. Another limitation is that there is no research among the Latin population in relation to how a mindfulness intervention can be integrated into weight management programs. So, this is basically a gap in the literature that should be addressed, and this was a turning point for this paper since, after conducting extensive research, this gap was found and therefore calls for the need to conduct research about mindfulness among the Hispanic population, especially after finding that the studies mentioned in this paper showed a positive weight loss trend among adults with obesity in the American population or individuals in the United States. So, adopting this intervention to the Hispanic population could benefit adults with obesity in the Hispanic population positively. In regards to the studies included in this paper, small sample sizes were a limitation since researchers stated that had these studies been conducted with larger sample sizes, maybe the results could have been more significant. Self-reported intake and self-reported data was also a limitation since it can always be subject to bias. Time allocated for the intervention was also a limitation in 3 studies, even though significant results were reported. Usually, mindfulness requires a lot of time in order to be able to practice the skill successfully. So, not having enough time allocated for the study in order to help individuals successfully practice and learn this skill could definitely be a limitation. Two studies also did not use a control group, so there was no group to compare findings to, and this also is a limitation. As a conclusion, methodological weaknesses and limitations may limit evidence strength, yet after going through these studies in this paper, outcomes clearly show that mindfulness based interventions have been shown to have a positive effect on the weight status of individuals. Definitely, future research should focus on the gap found in this review that needs to be addressed immediately in order to help adults with obesity in the Hispanic population improve their health and weight status. Those are my references, and thank you so much for listening to my presentation, and I hope you enjoyed it. Thank you.